Hello, my name is Chaya Chauhan and I own True Smile Dental Practice. I just wanted to make a series of videos to reach out to my patients, to be able to give them some advice and tell them what to do in certain dental emergencies. You may be wondering why all the dental practices in the UK are closed at the moment, and that is because the health authorities have asked the dentists to stop working because when you come to a dental practice, you may have some treatments that then may allow you to have COVID-19 transferred to you. For example, if you've ever had anything like a filling done or had your teeth cleaned via an ultrasonic scaler, you may notice that those treatments have some water used in our instruments. That water then can combine in with your breath, and then they can turn into water droplets and aerosols that disperse within the atmosphere up to 2 meters away from where we are actually working. So even though we use high volume suction and we try to suck up all the water, nonetheless the water can still disperse in the air via aerosols, and then it can sort of contaminate further people along the way. So that's why the health authorities have then decided to shut down the dental practices. So lots of my patients are wondering, dental practice is a really sterile environment, they're really clean, so why have we been asked to shut down? So there's the answer why. I just want to give you a little bit of information about COVID-19 as well. So COVID-19 actually spreads via water droplets. So for example, when you breathe, you can disperse your water droplets in your breath, and the water droplets can carry sort of a meter away from you. If you were to cough, that can be up to 2 meters, and if you were to sneeze, that can be up to 6 meters. So imagine when you're standing, anybody sort of within 6 meters has got potential to then be infected by your water droplets. And people may not know that they're carrying the disease. They may have no symptoms or just mild symptoms, and they may fight it off like minor cough or cold. But for somebody else, if you go to visit sort of Dot Branning at the laundrette and she's a little old lady, you may then find that although it didn't affect you, it may affect them a lot worse. So this is why we've been asked to really self-isolate. If you are to cough or sneeze, make sure you do it in your elbow or a tissue, and then throw the tissue away, and then wash your hands or wash your elbow or change your top. And this is just to stop the disease from actually spreading. So if you were to get COVID-19, what can happen is that you can feel poorly for up to 2 weeks, but then you can be a carrier for longer than that. So you have to isolate yourself for the full 2 weeks if you have had COVID-19 or somebody else in your household has had COVID-19 as well. So if you isolate yourself, you then are not a carrier anymore after actually having recovered, and then you become immune to COVID-19 yourself. So it's really good to listen to the government guidelines and listen to what they say, and constantly remember to wash your hands as well. Thank you guys.